Hi, everyone. My name is Jeffrey Colucci, and I serve the university as Student Body President, and I'm here today with Dean Rivera, the Dean of Students, and Dr. Davis, the Vice President for Student Life, to answer some commonly asked questions from our campus community surrounding quarantine and isolation. So to start us off, what is the difference between being in quarantine and isolation, and why does somebody go into quarantine or isolation?
Jeff, thanks for the opportunity to clarify some of this information as our community navigates this pandemic together. Really good questions. First, I actually want to point folks to Student Health Services website, which has a lot of Q&A information on it. But here, as far as quarantine and isolation go, isolation is a status that someone is placed into according to the CDC whenever we believe that they're sick, right? So they've tested positive for COVID-19 or they're awaiting their test results right now and they might have COVID-19 and we need to separate them from the general population in order to help prevent the spread. So an isolated person is a sick person. People who go into quarantine are separated from the rest of the population because of exposure. So they've had some kind of close contact with a person who is tested positive for COVID-19. Given the close contact, they may develop the virus. And so for the 14 days after their close contact, we want to make sure that they're not interacting with the general population, again, in hopes of preventing the spread of this virus on our campus.
So when can somebody come out of quarantine or isolation?
Good question. I hope that this infographic that you see on the screen is helpful in kind of explaining this. Isolation is generally something that lasts for 10 days. It's 10 days from the onset of symptoms in the case of someone who's symptomatic. In the case of someone who's asymptomatic, it's 10 days from the day that the test is collected. So 10 days from the day the person actually is swabbed. In the case of quarantine, students are quarantined for 14 days after their last exposure to the COVID positive person. So 14 days after that last close contact. The reason for that is that we know that coronavirus shows up between 2 and 14 days after exposure. This is also why a negative test during the period of quarantine doesn't get you out of quarantine, because a negative test on day 4 or 5 could be a positive test on day 10 or 11.
So where would a student be placed if they needed to quarantine or isolate? And then what does the life look like for a quarantine student?
Yeah. So according to the Royal Safe Together plan, students are encouraged to go home if they have to isolate or quarantine, simply because we believe that will be a more comfortable environment for them to be able to handle that period of time of being isolated or in quarantine. That said, we're aware that some students are not able to go home for different reasons. They might live really far away, or there might be a complex situation at home. And in those cases, for our residential students on campus, we work with them to try to identify another spot on campus where they can isolate or quarantine. Spaces are identified throughout our residential space on campus. In addition, we're also housing some students at the university's retreat center up at Chapman Lake. As far as what life looks like for a student in quarantine or isolation, I can't tell you it's very fun. You're really by yourself because we're trying to prevent the spread of this virus in your space. You have access, of course, to a bed and a desk and a bathroom to be able to utilize. Meals for residential students are delivered to them a couple of times a day. So at lunchtime and at dinner time. And at dinner time, we're providing snacks and also breakfast for the next morning. There's opportunities for support for students who are in quarantine and isolation. We've been lucky to have the Counseling Center launch a support group that meets Monday, Wednesday, and Friday from 12 to 1, recognizing that it can be hard from a mental health standpoint to be isolated. And so we want to make sure that we're doing what we can to support students through this. At the end of students' quarantine and isolation, provided that they are well, they're able to rejoin the population, kind of going back to life as normal.
So does a student have the right to self-quarantine if they feel like they need to?
So I'm going to actually ask Dr. Davis to answer that question.
Sounds good.
I was ready to jump in. So, self-quarantine, when a student gets placed into quarantine, they will be contacted by a contact tracer that the university has trained who will identify whether or not they've been a close contact of a positive COVID person. The contact tracer will then instruct the students on how to quarantine, and if they need to be moved to a temporary space, they will contact Residence Life to help facilitate that for a student. That process takes a couple of days from the time that a student is identified as a positive case until the contact tracers can get through all of their close contacts. And that's okay. It doesn't have to happen immediately because, as Dean Rivera said earlier, the virus takes a few days to ramp up in someone's system. So if someone's not sick and not showing symptoms, they are not required to quarantine until they are instructed to do so by a university official. So anytime a student is sick, we would ask them to contact Student Health Services. But if they just presume that they are a close contact, they're not required to do that until they're contacted by one of the university's contact tracers.
I think on that note, just to add, on the screen, you'll see before you the definition of close contact. And that's been something I've been talking with students a lot about. A close contact is really someone who has had some physical contact, hugging, kissing, sharing cups, that sort of thing, or someone who's been closer than 6 feet for 15 minutes or more. Anyone who doesn't fit that definition is more of a casual contact, not someone who is at risk, higher risk of contracting the virus, and so not someone who needs to quarantine. Only close contacts need to quarantine.
Awesome. Well, thank you, Dean Rivera and Dr. Davis, for providing some insights and answering some commonly asked questions by members of our university community surrounding COVID-19.
Thanks, Jeff.
Thank you, Jeff.